building and stand with you, but I need almost all of them. So they don't. My name's Tim Bohan. I'm a shop steward here for Local 39 at St. Francis Memorial Hospital Engineering Department. And basically I'm the strike captain since we've been on strike. We've been out here, this is starting our 9th week now. So I've been here, I've worked at St. Francis for 24 years in engineering. Probably almost the highest man in seniority except for our assistant chief engineer. But yeah, and so it's been like a home for me here for 24 years. It's really hard to see this going on in my house.
So what is going on here?
Well, basically our contract ended September 30th and Dignity Health refused to renew it. So October 1st we voted to go out for a strike. They gave us our last, best, and final offer, which was far below the industry standard for wages and benefits. And so we voted to go out to strike. And basically all we're asking for is the same, similar contract to all the stationary engineers that work in Bay Area hospitals, the high-rises, and the hotels.
And what are they trying to take away?
Well, they're trying to freeze our wages for a year, which is really hard, but even that's not a stopping point. The most serious point with the stationary engineers is that, with the contract, is that they want to take away our guaranteed 40-hour work week. Now that's a fundamental, benefit that we've been fighting for. They want to put in a provision in our contract. They call it a call-off provision, and that's in case that there are, as they say, if the patient census goes down, they can tell an engineer to stay home. In other words,
they still have the same square footage of space and everything to cover.
Absolutely, absolutely, and that's why that argument there. Now, granted, that might hurt us, but it's really going to hurt the hospital because our work doesn't go away. We maintain all the mechanical systems in the hospital. All the utility systems, everything that keeps it running, heating, ventilating, air conditioning, boilers, but the critical systems like nurse call, fire alarm, the medical gas system, emergency power, we maintain, and we also we test them to make sure everything's operational. But in addition to that, you need to know what's going to happen in case there are failures in any of these systems.
And it's a lot of complicated equipment in a hospital like this. How have they been able to manage without the engineers? Have there been problems?
It's interesting you ask that. Yes, there have been, and only the employees know firsthand. We have heard out here on the sidewalk some of the problems the hospital has had, and it's really hard to hear about it. But just in the first week, the first time they ran the emergency generator, there was a loss of emergency power for up to 10 minutes. It should be a mere 2 seconds when they test the emergency generator. 2 seconds it takes to transfer from PG&E to emergency power, and they lost power. It's because they had new engineers that were not familiar with the test operating the equipment. Now, all the normal power stayed on, so I'm not saying they lost power in the whole building, but the emergency power system was down longer than it should have been.
And this company, Dignity, who are they?
Dignity Health is a huge corporation. They call themselves, it's a nonprofit corporation. It's one of the largest in the country. Of 35 nonprofits listed, that we have a document here that shows their earnings, they are the number one at $10.5 billion fiscal year ending 2013, June 30th. 10.5, they're the largest. So money is not an issue here as far as settling our contract. What they are is a huge corporation, and they own 3 hospitals in the Bay Area: St. Francis, St. Mary's, Sequoia, and Redwood City. There's a 4th hospital, Dominican, in Santa Cruz. And all 4 of these facilities are on strike right now since October 1st.
So they're spending a lot of money on replacement workers and bringing in other people?
I'm sure they are. They brought people, they had to bring them from out of state. They brought people from across the country to operate the system, and they have people whose resumes they got off the internet, monsterjobs.com for one of them. I'm not sure where everybody came from, but they have resumes that say they are mechanical people, they know how to operate boilers, but it takes a long time to understand the systems that they're operating, and that's really the problem here. When we have a new engineer come on duty, we train them. It takes 3 months before we allow an engineer to stand watch alone.
And what would this impact have if they're successful on other engineers? You have master contracts for hospitals, hotels. How would it affect other engineers?
Well, if you take and you lower the industry standard for wages and benefits in one area, it's going to have an effect that's going to go through the industry. You know, one person's going to say, hey, we can do it there, we'll do it somewhere else. But the biggest problem, the reason we have to stand strong and not take a lesser contract is for these hospitals, because they will lose their experienced engineers. I will not be able to keep my crew. If they can go down the street and earn more money, they're not going to stay here. And so some engineers have already left because of the length of the strike. It's been, we're in our 9th week now, like I said before. Some engineers have left. I know there's been some have left Sequoia Hospital, St. Mary's. We have lost one who's taken another job here, and everyone else is working on their resumes.
Well, are you getting strike payments?
We do. The local is great. They give us $300 a week for picket duty, and what we're getting more than the strike payments is the support from the hospital staff here in the hospital. And I don't mean just the staff, but not only union workers, but non-union staff, but even managers and supervisors. They know, they see firsthand what's happening to the hospital, and they hate to see us out here. So they bring us coffee, bring us food, people are baking snacks and other gifts, and that's really the biggest support we get on the strike line.
So these executives who forced you out, you said that they are making a lot of money. I mean, what are the executives at Dignity Healthcare?
I know the CEO, the chief executive, Lloyd A, raked in $5.1 million fiscal year June 30th. Those are stats we have. That comes out to about $325,000 a month. Okay, now that's the man at the top. And what the main problem I see with that kind of income is it just creates such a divide between understanding what we do, what our job is, and how we get by on our wages. There's just no way these people can understand. I equate it with royalty. Excuse me, but I think that's the best way to get a sense of how big the divide is.
And the other unions here that are in the hotel, in this hospital, are they supporting you?
The other unions, they're exceptionally supportive. Morally, they're out here. They've walked with us. The CEIU members have come out, carried pickets with us, and marched in front of the hospital. They're very supportive. The nurses are supportive. CNA, they come out here, and it's wonderful, to see the support from the other union members. What has happened, the reason they do not honor our picket line and stay out here with us, is the corporations have gotten really smart. They put no strike clauses in the contracts. Basically, sympathy strikes have gone away, and that used to be a real fundamental foundation that gave the labor fights a lot of strength, and you don't see that now. A union member on their own can honor the picket and stay out here with us, but then they adopt the strike as their own, and once they adopt the strike as their own, they're out here with us for the duration. But they have the same protections to get their job back. It's a little hard expecting that out of our co-workers. That's a big choice to make.
Now, there are state and city codes as far as health and safety conditions in the hospital and oversight to see that the patients in the hospital is protected, the people in the hospital. Are they enforcing these codes?
Absolutely. I'm sure those codes are being enforced. They are enforced in the engineering department. We are the record keepers for all the required documents for the regulatory agencies, joint commissions, CMS, Department of Public Health. All right, they come in and they inspect our records. And yes, they enforce the codes. And the question is, when they do their periodic inspections and they come back again to inspect, I'm concerned that those inspections have not been done properly. It's just a concern because they have a smaller crew of maintenance workers. Those maintenance workers, they needed security to show them where the machine rooms were. They don't know what equipment operates what area. They don't know where the equipment is, and they have to do inspections. We're talking there's negative pressure rooms. They have to know where all the rooms are. They're throughout the whole hospital. There's about 16 of them, if I remember correctly, maybe more. And just to find the rooms, these people don't know that there's 3 buildings that make up St. Francis Memorial Hospital. It's the 58, 68, and 78 building. And when they came here, they had to be shown where the buildings were. So that's my biggest concern, is that the documentation for the required codes, they need to work on it. And I think we're going to have to work on it very much when we go back in.
And how long are you prepared to stay out?
Till to the end. This is a battle. We need to stay out. We need to stay out. We need to be here. We can't let down the fellow employees, the hospital. We need to get back inside, put this place back together, and it needs to happen sooner than later, so that we can hopefully correct any of the damage that may happen before the next Joint Commission inspection, the next state inspection. We can bring things back into shape, because I know that some of the failures they're having in the systems takes longer to repair. Some of them persist, and we hear this from employees that come out and tell us about temperature control problems with the fire doors. One whole day the fire doors didn't reset, and those are magnetic holders that hold those doors open. Well, that's really a problem. I can only imagine they had trouble resetting the fire alarm system, perhaps. I don't know. I don't know for sure, but like I said, it's just what we hear on the street here, and so we are concerned.
What can people do to support you?
Well, the best thing people can do to support us right now is the easiest thing is to talk to us. Come out here, take my flyers. We're passing out flyers. I have a tote bag I wear with me every minute I'm on picket duty. I have a flyer that says, "Do you know who we are?" It tells what engineers do, and then I couple that with another flyer, which is an update on our negotiations. And it's the most recent update is that we've offered binding arbitration at our last federal mediation. We offered binding arbitration. Dignity has refused. And so we give these flyers to people. That flyer has the address of Dignity Health's corporate office. They can write to Dignity Health. It's 185 Berry Street, San Francisco, and write that to Lloyd Dean. Zip code's 94107 1739. But they can write a letter to Dignity Health. They can make a phone call. They can call this hospital. Now, the reason I say the Dignity Health and the corporate offices is because I believe that if the decision was in the administration in this building, we would have been back to work long ago. The people in this building, they see firsthand how badly they need us inside. And I think that would have happened. But call the hospital, let them know you're concerned about the strike.
So there's not too much dignity for the workers here, the way they're treating you.
The real dignity that we have come to know is about our job. It's a professional dignity. It's a dignity in knowing that we're carrying on the fight for labor. The fight for labor is going on right here, right now. This is the front. This is where it has to happen. And in all my years of being a union member, 24 years as a stationary engineer, 15 years as an IBEW electrician before that, all my years as a union member, this is the first time I've ever been on strike. And I will have to tell you, there's dignity in that. There's an honor in that it's my time to give back to the union, to give back to the labor struggle. So that's where the real dignity is. And in the employees that come out and show us how much they miss us and how badly they want us back inside. As far as the media not being interested, I'm afraid that the guards.
My name is Peter Leon Guerrero. I said I'm the Biomet Chief Engineer. I said we maintain the hospital patient monitorings, equipment, defibrillators, I said anesthesia machines, the critical stuff. Of course, along with all the other medical equipment. So we're out here, and there are folks in there. Supposedly they're qualified. But that's not what I'm hearing from the staff coming back out. So they're ready for us to come back in and fix the equipment, both on the Biomed side and also on the facility sides. So
this is a life and death issue as far as this equipment being running properly.
Yes, but I don't know what's happening other than what I'm hearing.
What are you hearing?
The work orders are being sent in for service, for repair, and it's taking too long for things to happen. And it's I don't know the specific equipment, but they need the equipment to maintain and, as I said, take care of their patients. Yeah. So, for every equipment that goes down means that's one less patient they're taking care of. On the critical equipment, that's just what it is. You have to be in compliance. There's no tolerance. It has to work first time out. And the defibrillators are those critical equipments that I don't know how the maintenance is being performed. Yeah.
So who's doing oversight to see that these people know what they're doing that they brought in?
Interesting. There is a company in there. I said they've taken over the management portion of the biomed department. Their company name is Trimedics. So they're running the operations, and they do have Trimedic staff in there. I'm hearing it numbers between 3 to 5. Well, there was only 2 biomeds, me and my tech. So it's taken them to try and figure out how to do our work. It just shows that they don't know the facility, they don't know the equipment, and they're needing more people to take on the workload that 2 technicians normally do. And I do try and pay attention to who comes in, but it seems like their faces keep changing. So I don't. The numbers fluctuate on the biomed side. The engineers, the same thing. I said it's hard for me to figure out who all the engineers are. But if you look like an engineer and you dress like an engineer, you're probably an engineer. Yeah.
So they're spending a lot of money, millions of dollars fighting you?
Easily. I said just bringing the staff out here to augment what the engineers that are out here on the strike. That costs money. I said they're having to pay premium because the other union has said engineers that are in facility won't cross the strike. So they're having to find some other companies that are not union to come in, and I'm sure they're paying premium for those companies to the same service. There is companies that won't cross it, and we allow them to they say you got to do the right thing. They said take care of our staff, take care of our patients, and if it comes down to life-death situations, they said then go and take care of it, but don't do routine maintenance. And those union folks tend to honor our picket.
So they're trying to get rid of the 40-hour work week. What are they trying to do here to the engineers?
On the 40, well, there's 2 issues. What's that? One is the actual wages. And all we're asking is fair wages. We're not asking that any more than what Kaiser, Daughters of Charity, and Sutter hospitals have signed on. And there was 26 hospitals that were up for contract renewal October 1st. Of those 26, 18 were served strike notices. So Dignity Health was not the only hospital that had the strike notice. Of the 18, 4 of them was of course, the Dignity facilities were the ones that did not heed our strike notice, and so that put us out here. So we've been out here 2 months, starting our 3rd month. So it's just fair wages. That's one issue. The other issue is the 40-hour work week. I said they want us to flex off when the patient census drops, and that's okay if you're maybe a doctor or nurse. So say you got no patients, why come in? But the equipment says that don't. It's not driven by the patients. If you have scheduled maintenance, they're set for servicing of the equipment. And it doesn't matter whether you have 1 patient or 100 patients, it still requires that same maintenance. And for, repairs of equipment, the best time to service the equipment is when you don't have a patient on it, when you can actually spend quality time and service that equipment appropriately. So the 40-hour work week, it just doesn't make sense, because all that does is pile up the work on us when we do come back, and you're not going to catch up. We barely have enough staff to even just man the picket line. If we have 2 people per shift, and we got 1 individual that floats to relieve us, so we can have at least 1 day off a week. So we're manning this picket 24/7 at St. Francis.
So there are thousands of other engineers here in San Francisco. What would the effect be if they were successful? Would it spread to other industries, hospitals, hotels, buildings?
Yeah, I would assume so. And just within our hospital, we have 3 unions here. If they break us, get us out of here, or have us accept the 0% pay increase for the first year, then the other unions will follow suit. They actually tried that on us, where they stated that the nurses and the SEIU have settled for that 0% in the first year, and they did not strike. So now they have 0% and less of a salary for their contract. We will go with a 0% as long as we make it up in the remaining 2 years on the 3-year contract. So that at the end of the contract, we will just be the same as Kaiser and the other healthcare facilities. So if they break the unions in the hospitals, then everybody will be following suit, and they're going to forget why they got those nice wages. It's because of the unions out here. Cost of living in San Francisco is extreme. I live in Vacaville. That's about an hour and a half commute every day one way, and that's on a good day.
You can't afford to live in San Francisco. You have to commute.
I cannot afford to live. No, I love San Francisco. I love coming to work. I love going home. Yeah, because it's like being a little tourist. But there's no way I can afford to live in San Francisco unless I have a studio or 1-bedroom apartment.
Here at St. Francis Memorial Hospital, we've just recently experienced TriMedics is coming in, and they're doing the managing of the biomedical department. Aramark is in here, and they're doing environmental services, and they're taking over the management of food services. And then the next company coming in is going to be Optum 360, will be doing management in, I believe, to do with medical records, so health information services. And what's happening when the companies come in, the existing managers, for example, I know what I've heard in some of the other departments where they've already come in, is that the existing managers, their wages are reduced, they have to pay their own health benefits, and some of the managers have left. And so they're losing some people with many years experience, and it's all, so they're outsourcing to private companies, and I can only imagine that this is costing Dignity Health a lot of money. So, how's this working for them? So that's what's going on here. Said as far as the media not being interested, I think I'm afraid